Hello. This video is not part of any previous series. But every medical student needs this explanation, so watch it till the end. Andy, please focus. Let's go step by step through the arterial blood supply of the whole body from head to toe. All arterial blood starts from the left ventricle of the heart. From there, blood enters the ascending aorta, then the aortic arch, and continues as the descending aorta. From the aortic arch, blood is sent to the head, neck, and upper limbs through three main branches. From right to left, these are the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. To remember their order, think of a normal daily routine before coffee sleep. Brachiocephalic carotid subclavian. Each common carotid artery then divides into two branches. The internal carotid artery supplies the brain and eyes. The external carotid artery supplies the face and scalp. Just remember, internal goes inside to the brain, external stays outside to the face. Blood reaches the upper limb through a clear sequence. The subclavian artery becomes the axillary artery, then the brachial artery, and finally divides into the radial and ulnar arteries, which form the palmar arches and supply the fingers. To remember this flow, imagine blood moving down the arm step by step. Subclavian, axillary, brachial, radial, ulnar, palm, digits. As blood continues downward, the descending thoracic aorta supplies the chest wall and thoracic organs. It then passes through the diaphragm and becomes the abdominal aorta. The abdominal aorta gives important branches to the abdominal organs. The key ones, from top to bottom, are the celiac trunk, the superior mesenteric artery, the renal arteries, and the inferior mesenteric artery. An easy way to remember this is celiac feeds the upper gut, SMA feeds the midgut, renal feeds the kidneys, and IMA feeds the lower gut. At the level of the pelvis, the aorta divides into the right and left common iliac arteries. Each common iliac artery then divides into an internal iliac artery, which supplies the pelvic organs, and an external iliac artery, which continues to the lower limb. Just remember, internal stays inside the pelvis, external exits to the leg. The external iliac artery becomes the femoral artery in the thigh. It then continues as the popliteal artery behind the knee and divides into the anterior and posterior tibial arteries. A simple walking sequence helps here: external iliac, femoral, popliteal, tibial. Finally, the foot receives blood from two sides. On the dorsal side, the anterior tibial artery becomes the dorsalis pedis artery. On the plantar side, the posterior tibial artery divides, forming the plantar arch and supplying the toes. Think of it as top of the foot is dorsal, bottom of the foot is plantar. If you follow this flow from start to finish, the whole arterial system becomes one connected story. Follow Medify with Morale for more clear, high-yield medical explanations. Goodbye.